Welcome, ladies and gentlemen, to the Cuyahoga County Human Resources and Appointments and Equity Committee meeting this Tuesday, March 4th. Roll call, please.
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Mr. Sweeney. Mr. Sweeney is absent. Mr. Gallagher?
Here.
Ms. Conwell? Ms. Turner?
Present.
Mr. Hauser? Mr. Hauser is absent at the moment. You have a quorum. And let the record reflect that Councilmember Kelly is in attendance, and in accordance with Rule 12F of the County Council Rules, Council President Miller has appointed Councilmember Kelly as a member pro tem of the Human Resources Appointments and Equity Committee.
Welcome, Mr. Kelly. Thank you. Public comment?
Mr. Chair, no one has signed in.
Thank you. In your packets, we have the meeting minutes of February 18th meeting. If they're in order, I'll accept a motion in a second.
So moved.
A motion and a second. Further discussion? All in favor?
Aye.
Against? Thank you. We're going to start with 0085.
Resolution 2025-0085, confirming the county executive's reappointment of the Honorable Judge Donna Congeni Fitzsimmons to serve on the Cuyahoga County Diversion Board for the term March 1st, 2025 through February 29th, 2028.
Good morning, Mr. Chair. Ben Schaefer on behalf of the Cuyahoga County Executive. Pursuant to Section 208.04 of the Cuyahoga County Code and Section 6.04 of the Cuyahoga County Charter, I'm here to recommend the reappointment of the Honorable Judge Donna Congeni Fitzsimmons to serve on the Cuyahoga County Diversion Board for the term March 1st, 2025 through February 29th, 2028. We are requesting second reading suspension.
And we were notified that the judge would not be here today. Committee, we have confirmed her before for this seat, and without objection, I would accept a motion and a second to move this candidate forward under second reading suspension. I have a motion. Oh, I was rambling. Thank you. We have a motion and a second. Any further discussion? All in favor?
Aye.
Aye. Thank you.
Resolution 2025-0086, confirming the county executive's reappointment of Chief Dorothy A. Todd to serve on the Cuyahoga County Diversion Board for the term March 1st, 2025 through February 29th, 2028.
Good morning, Mr. Chair. Ben Schaefer on behalf of the County Executive. Pursuant to Section 208.04 of the Cuyahoga County Code and Section 6.04 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Chief Dorothy A. Todd to serve on the Cuyahoga County Diversion Board for the term March 1st, 2025 through February 29th, 2028, and we are requesting second reading suspension.
Again, we were notified that the chief would not be able to be in attendance today. We have confirmed her before for this position. If everybody's comfortable with that, I'll accept a motion for second reading suspension. Thank you.
So moved.
A motion and a second. Further discussion? All in favor?
Aye.
Against? Thank you.
Resolution 2025-0087, confirming the county executive's appointment of Xiomara Merced to serve on the Cuyahoga Regional HIV Prevention and Care Planning Council for the term February 1st, 2025 through January 31st, 2028.
Good morning, Mr. Chair. Ben Schaefer on behalf of the County Executive. Pursuant to Section 6.04 of the Cuyahoga County Charter, I am here to recommend the appointment of Xiomara Merced to serve on the Cuyahoga County Regional HIV Prevention and Care Planning Council for the term February 1st, 2025 through January 31st, 2028. We are requesting second reading suspension.
Thank you. Is Ms. Merced in attendance? Let the record reflect.
And let the record reflect that
Mr. Hauser's here.
Mr. Hauser is in attendance. Thank you.
Welcome.
Good morning, everyone. Pleasure to be here. My name is Xiomara Merced, Director of Infectious Disease Operations and Grants at Metro Health Medical Center. My background, I've been working with the HIV population for 15 years. Started off as a housing case manager, providing direct service to our patients in the community, and then went into more of an administrative role when I went into Metro Health, overseeing a lot of the HIV programming and grants, and I currently direct the whole program at the moment.
Thank you. Are there questions? Well, you're going to have an easy day. Hearing no questions, I would accept a motion. Are you expecting this to go under second reading?
Yes, Mr. Chairman, I believe I requested second reading suspension, please.
If everybody's comfortable moving 2025-0087 to the full council under second reading suspension, I'll accept a motion in a second.
So move.
Motion in a second. Any further discussion? Hearing none. All in favor?
Aye.
Aye. Against? Thank you.
Thank you very much.
We appreciate your efforts.
Resolution 2025-0088, confirming the county executive's appointment of Sahara Rivera to serve on the Cuyahoga Regional HIV Prevention and Care Planning Council for the term April 1st, 2025 through March 31st, 2028.
Good morning, Mr. Chair. Ben Schaefer on behalf of the county executive. Pursuant to Section 6.04 of the Cuyahoga County Charter, I am here to recommend the appointment of Sahara Rivera to serve on the Cuyahoga Regional HIV Prevention and Care Planning Council for the term April 1st, 2025 through March 31st, 2028. We are requesting second reading suspension.
Ms. Rivera. Welcome.
Good morning. I am Sahara Rivera. I'm a PrEP navigator and Trans Health navigator at Metro Health Main Campus. I've been in my role, April will make 2 years. I specifically work in prevention for who I call the babies. They're usually 20-ish and under is who I try to really get the messaging out to about HIV prevention, and also other STD, STI testing. Along with trans health navigation that I do, I also tie in sexual health, as Black trans women are oftentimes affected by HIV at higher rates. So while they may come to me for gender affirming care questions and needs, I also tie in sexual health and HIV prevention if they're negative, but also if they're positive, just keeping them in care and making sure they stay on their treatment. So that is a little bit about me.
Thank you. Questions? Yes, ma'am.
Through the chair to Ms. Sahara, how's the funding from the federal level been? Is it drying up? Have you?
As
anything that
of,
you've seen?
I'm sorry. As of right now, we are still operating as usual. While there are a lot of threats about funding freezes and cuts, nothing has been done yet. So we're still serving the populations and the communities like we always have been, or as we have been, until someone gives us a hard stop. So we're still showing up for them and creating safe spaces for them to show up. Thank you.
Through the chair,
Yes, ma'am.
is PrEP an acronym? And what does this stand for?
Sorry. So PrEP is pre-exposure prophylaxis. It's not a new concept. So if you travel to certain countries out of the States, like there's PrEP for malaria and other diseases if you're going to certain countries. PrEP is, I would say, new-ish to HIV prevention, being that it was rolled out, I think, 2012. So anyone who is HIV negative can take PrEP. It's for everyone, whether you're trans, cis, heterosexual, gay, lesbian. PrEP is for everybody. Just be at least 72 pounds. And so there's pill versions and there's also injectables if people don't tolerate pills. And there's always labs and checkups every 3 months to make sure that there are no serious side effects. And so that's what PrEP is for.
Okay. So this is your first time serving?
I'm sorry?
This is your first time serving on this board? This is
Yes, ma'am.
a new nomination? Okay. Well, thank you for your service. Happy to see you this morning. Absolutely support this nomination.
Any further questions? Yes, ma'am.
Wanted to follow up through the chair to Ms. Sahara. So in light of Councilwoman Turner's question, I'm just trying to get clear on PrEP. So PrEP, you said, could be an appeal form. Is that something that they take if they already have HIV or to prevent?
It's for prevention. So anyone who is HIV negative seeking out PrEP can take PrEP. So in order to start, there are baseline testings like STD, STI testings, but also HIV testing to be sure they're negative. And as long as that comes back, then they can be started on PrEP by their provider. And they get tested every 3 months to be sure that they're still HIV negative and they haven't seroconverted. And they continuously take PrEP. But PrEP isn't something, once you start it, you have to take lifelong. If circumstances change, you can stop taking PrEP. If you get into a monogamous relationship and you feel comfortable with your partner, you can stop taking it. Or if you practice abstinence, you can stop taking it. But once you get back to being sexually active, you can always say, hey, I'm going to get back on PrEP now.
That was a follow-up question. So why not, or do you offer it to heterosexuals?
We do. PrEP is
Okay,
for everyone. Oftentimes in the messaging and the marketing, a lot of cis women particularly think PrEP isn't for them because most times they don't see themselves in the marketing. So when we're out tabling at events like Pride in the Clee or community events, we talk to a lot of different people, and we go to different organizations to try to get the message out there. Like we recently tabled at an expungement clinic in Warrensville Heights. And most people are like, well, why would a sexual health table be there? Because PrEP is for everyone. So we try to get the messaging and the marketing out there that PrEP is for everybody. And even if you don't see yourself in the marketing, there are options for everyone who doesn't identify as LGBT.
And you mentioned, through the chair, you mentioned the only caveat would be if you were 72 pounds or less. So 72 pounds is probably junior high or something
Yeah,
like
so
that.
yeah, so so I've navigated the youngest person I've navigated PrEP for is 16, I think. And their parent was on board. They have a good relationship talking about sexual health. So really and we know like everyone's weight is different at different ages, but so if the way I look at it is if someone is seeking out a need for a specific thing, we're going to do our best to get it to them as long as it's safe and it'll be effective for them.
Anything further? Hearing nothing, if everything's in order, I'll accept a motion and a second on Resolution 2025-0088 to the full council under second reading suspension.
Second.
A motion and a second. Any further discussion? All in favor?
Aye.
Against? Congratulations. Thank you.
Thank you.
Resolution 2025-0089, confirming the county executive's appointment of Adam G. Jacobs to serve on the Metro Health System Board of Trustees for the term March 6, 2024 through March 5th, 2030.
Good morning, Mr. Chair. Ben Schaefer on behalf of the county executive. Pursuant to Chapter 339 of the Ohio Revised Code and Section 6.04 of the Cuyahoga County Charter, I am here to recommend the appointment of Adam G. Jacobs to serve on the Metro Health System Board of Trustees for the term March 6th, 2024 through March 5th, 2030. We are requesting second reading suspension.
Thank you. Mr. Jacobs. Welcome.
Thank you. Good morning, everybody. My name is Adam Jacobs. I'm pleased to be here, and thank you for entertaining my nomination to the Metro Health Board. Maybe to start off with a little bit about myself. I've lived in the county for 35 years. I've raised a family with my wife, Melissa, in Chagrin Falls. I have 2 adult children and 4 grandchildren now. I think some of you may know me from my work prior to this with Belfair and Wingspan. I retired about 8 weeks ago. And so to keep my marriage together, I am looking for other endeavors of interest to me, and certainly healthcare and helping those who have drawn the short straw in life and need healthcare is of interest to me. So I could talk a little bit about my experience or just answer questions.
Well, do we have any questions? I've read your resume extensively, and it's very impressive. Yes, ma'am.
Through the chair to Mr. Jacobs, how do you see, from where you previously come from, how do you see your role on the board of Metro Health helping or assisting with?
Well, if I kind of take a look at my experience over at Wingspan and through some other agencies, I have had to develop an expertise in finance and auditing procedures, just because the slang or the comment is, no money, no mission. And Wingspan, like Metro Health, is a mission-oriented organization, but we need to have solid finances to continue to move forward. So that's one area of expertise. But, I think it was Harry Brown, formerly of Banish, that said that healthcare in general is the second most regulated entity in the United States after atomic energy. So I've had to become familiar with a lot of the regulatory process and with multiple stakeholders. So I think, understanding that we have multiple stakeholders at Metro Health will help me navigate my position being a board member.
Just a follow-up question. When you were CEO and president of Belfair, did the children go to Metro Health for care?
More of the children over at Applewood ended up, just because one of Applewood's campuses is on 25th Street. Dr. Milliner, who's a pediatrician at Metro Health, is the immediate past chair over at Applewood.
Further questions? Yes, sir.
Adam, I don't think we've met. I do know Councilwoman Simon speaks very highly of you. My question is, can you list some of your priorities in your term on the Metro Health board? What are some priorities if you were able to get this appointment?
Well, when I think of, the overriding objective is our mission. And so when I think of, maybe a better way of putting it, the overriding objectives when fulfilling that mission are, we need to do what's in the best interest of our patrons, the clients that we serve in our community. We need to do balance that with the best interest of our staff. We need to keep in mind all the time that we need to do it legally within the regulatory restrictions that are imposed upon us, and we need to do it in a financially responsible way to run a balanced budget. And if we can meet those four goals, staff, our clients, the regulatory environment, and our budget, then I think we could do a good job at our mission of helping people.
And then I just follow up. Any thoughts on how you could support Metro from a financial sustainability perspective?
Well, as everybody in this room knows, there's some headwinds coming because of the changes in Medicaid and possibly the changes in the way, I'm not sure I got the number right, the 304B pharmacy piece. So I think we're going to have to do some scenario building. What are we going to do if worse comes to worse, and if only minor changes present a problem? And I think that scenario building with my future colleagues on the board, if I'm appointed, and staff will be helpful. And we'll have to look at a number of ways of dealing with those headwinds.
Thank you.
Well, Mr. Jacobs, we as a body have always considered Metro Health one of our main priorities, and it's important to us. And many of my colleagues and myself have been outspoken regarding Metro. You're walking into a situation we've had ups and downs since we've been here, and hopefully we're on an upswing because the past 5 or 6 people we had put on the board have been just absolutely fantastic, and I would include you in that. And my only request for you is the request that I ask of everybody, is to be your own person, keep your eyes open, see what's going on and make the right decisions at the right time. That has not always been done in the past, the recent past. And we're hoping to clean that up. And with your appointment, I hope that'll move that mission forward to make Metro as best as it can be.
I hope I can live up to those standards. Thank you.
Anything further? If everybody's comfortable with Mr. Jacobs, I would recommend I would accept a motion for 2025-0089 to the full council under second reading suspension.
So, second.
A motion and a second. Any further discussion? Hearing none. All in favor?
Aye.
Aye. Against? Congratulations. Good luck.
Thank you.
And we'll go back to 0084.
Resolution 2025-0084, confirming the county executive's reappointment of Tanisha Warren to represent Cuyahoga County on the Child Abuse and Child Neglect Regional Prevention Council for the Great Lakes region for the term January 24th, 2025 through January 23rd, 2027.
Good morning, Mr. Chair. Ben Schaefer on behalf of the county executive. Pursuant to Ohio Revised Code 3109.172, Ohio Administrative Code Rule 5185-1-01, and Section 6.04 of the Cuyahoga County Charter, I'm here to recommend the appointment of Tanisha Warren to represent Cuyahoga County on the Child Abuse and Child Neglect Regional Prevention Council for the Great Lakes region for the term January 24th, 2025 through January 23rd, 2027. We are requesting second reading suspension.
Ms. Warren, please. Welcome.
Thank you. Good morning.
Good morning.
Ms. Warren, if you could state your name for the record, please.
Yes, Tanisha Warren.
Yeah.
If you could tell us a little bit about you.
Yeah.
That's the hardest thing to do,
I
isn't
know,
it?
right? So I've been a Cleveland resident my entire life. I graduated from Cleveland Public Schools. I have my undergrad in social work from CSU and my master's in social work from Case Western. Currently, I am a foster care team lead for the National Youth Advocate Program. I've been with that organization for almost 4 years now. So we work with foster families and foster youth. We have contracts with different counties to place them in foster homes. I have 2 kids, a 15-year-old and an 8-year-old, and I've been married for about 7 years.
Thank you. Questions? This is an easy day for everybody. Normally it goes on and on. If I don't have any concerns, I would accept a motion on 2025-0084 to the full council under second reading suspension. Mr. Hauser, before that.
Question to the chair, to Tanisha. Tanisha, this is a reappointment.
Yes.
Can you just tell me a few highlights that you were able to get accomplished during your previous term?
Yes. So we work with different counties for the organization. We've been kind of reviewing data from some of the programs that they provide funding for. So just being able to learn what the funding is actually doing, like kind of seeing the work with the data and the results for the families. So we've talked about like some of the programs that we've had and the results, hearing the success stories, and also just kind of figuring out if these programs are meaningful, if they're actually doing what they say they are going to do. So we've been kind of going over that, talking about the different needs in the counties. As we know, like different counties have different needs, like Ashtabula is more rural, so they don't have a lot of services and things like that versus Cuyahoga. So just kind of implement things that will be meaningful for the families.
And then last question, Tanisha, what unique attributes do you think you bring to the council?
Honestly, I think I bring a lot of real life contributions. Like I said, I lived in the inner city my entire life. Just kind of understanding what it's like to be on both sides, I would honestly say. Honestly, having that perspective of knowing what families need and what works for them, and not sitting on a like kind of a hierarchy position and looking down. Like, I guess the real life experience is my contribution to the organization, I would say.
Appreciate it. Thank you.
Yes, ma'am.
Through the chair to Ms. Tanisha, what are some of the preventive services that you guys provide?
They do the parent cafe in regards to like kind of going over things with parents, different interventions and stuff for behaviors. We also do the fatherhood initiative where they have programs for the fathers, just kind of promoting that positive interaction with the families from the father perspective. And then they also provide different organizations with funding to help with, let's say, rent assistance, utility bill assistance. They do programming for different families in the community, kind of promoting that sense of togetherness.
Poverty plays a big role,
Yes, socioeconomic status definitely plays a big role.
getting children removed from the home. And I know has your organization worked closely with Director Fletcher from Department of Children and Family Services?
My job or OCCF?
Just either?
Oh, yes.
Okay.
My National Youth Advocate Program, definitely. Based on my regional manager, she has a lot of contacts with the county and things like that, and just trying to make things better, more streamlined, honestly vetting foster parents and things like that, and honestly putting services in place that, you know, lead to success, reunification, and things like that.
What about kinship care?
Yes, we do have families that provide kinship care. So we want them to become adoptive parents so they can then still get the subsidies to assist. So we do have a lot of grandparents, aunts and uncles and things like that that are foster parents with our agency. So we promote that as well.
Thank you.
Anything further? Hearing none, if everybody's comfortable, we'll move 2025-0084, the full council under second reading suspension. Accept the motion in a second.
So moved.
Second.
Motion and a second. Further discussion? All in favor?
Aye.
Against? Thank you. Congratulations.
Thank you.
Miscellaneous business? Hearing none. Thank you.